Look closely at the skin on the back of your hand. Now compare it with the softer skin hidden beneath your upper arm, an area that has lived the same number of years and belongs to the same body. Notice the difference. The skin protected from years of sunlight is often smoother and clearer, while the areas exposed every day begin to show those familiar brown patches many people simply call age spots. But those marks are not caused by aging alone. If time itself created them, they would appear evenly across your entire body. Instead, they appear where sunlight has repeatedly reached your skin for decades. Your hands, arms, face, and chest. These spots are actually a record of exposure, inflammation, and changes happening beneath the surface. Vital aging wants to explain what these spots really mean and what you can do. Those brown patches are often called solar lentigines, a medical term that describes areas where sunlight has influenced the behavior of pigment-producing cells. Many people mistakenly call them liver spots, but that name is misleading because your liver has nothing to do with their appearance. These marks are not a sign that your liver is unhealthy. They are simply evidence of what your skin has experienced over many years. Every time sunlight reached your hands while driving, gardening, walking outside, or sitting near a window, your skin responded by producing protective pigment. Over decades, some pigment-producing cells can become overactive and continue creating melanin even when it is no longer needed. At the same time, your skin's natural renewal process slows down with age, meaning old pigmented cells remain visible longer. The result is a darker patch that stays on the surface instead of fading away naturally. The reason these spots develop comes down to two important processes happening inside your skin: increased pigment production and slower removal of old pigment. Deep within your skin are specialized cells called melanocytes. Their job is to create melanin, the natural pigment responsible for tanning and skin color. Under normal conditions, these cells receive signals from the body, telling them when more pigment is needed. Sun exposure, inflammation, and oxidative stress can activate those signals. After many decades, some melanocytes can become overactive and continue producing pigment even when the original trigger is gone. The second factor is your skin's ability to renew itself. When you were younger, your skin replaced old surface cells more quickly, allowing damaged pigment to gradually disappear. As you grow older, this renewal process slows down. Cells that once faded away within weeks may remain visible for months. This combination of increased pigment production and slower skin renewal is
One important thing to remember is that not every brown mark on older skin has the same cause. While many spots are harmless solar lentigines created by years of sunlight exposure, other factors can also change the color of your skin. Certain medications, for example, may contribute to increased pigmentation in some people. Some heart rhythm medications, antibiotics, anti-inflammatory drugs, and other treatments can sometimes cause darker patches to appear. This is why paying attention to timing and location matters. If a dark patch appeared suddenly over a few months instead of slowly developing over many years, or if it appears in areas that rarely receive sunlight, it is worth discussing with a healthcare professional. Bring your medication list and ask whether any of your prescriptions could contribute to changes in skin color. A simple question can sometimes reveal an overlooked cause. Your skin changes are not always just about getting older. They can also reflect medications, environment, and how your body responds over time. One of the most interesting parts about treating these spots is understanding the role of a pigment control enzyme called tyrosinase. Think of tyrosinase as one of the main switches that tells pigment cells to begin producing melanin. When sunlight, inflammation, or oxidative stress repeatedly activates this pathway, your skin can continue making extra pigment long after the original trigger has passed. The good news is that some skincare ingredients can help reduce this activity. One of the most studied options is niacinamide, a form of vitamin B3 that works differently from harsh lightening products. Instead of attacking pigment cells, it helps reduce the transfer of melanin into the upper layers of the skin, where discoloration becomes visible. It also supports the skin barrier, which is especially important after 60, when skin often becomes thinner, drier, and more sensitive. Consistency matters more than quick results.
These ingredients usually require several weeks of regular use before noticeable improvement appears. The goal is gradual fading, not overnight disappearance. Another ingredient that has gained attention for uneven skin tone is azelaic acid. Unlike some stronger treatments that may irritate sensitive skin, azelaic acid can be a gentler option for many people. It helps influence pigment production while also calming inflammation, which is important because ongoing irritation can leave behind darker areas known as post-inflammatory hyperpigmentation. This type of discoloration can happen after something as simple as a scratch, insect bite, rash, or repeated rubbing of the skin. Vitamin C is another option that works in a different way. A stable form of vitamin C can help reduce oxidative stress while also supporting a more even skin appearance. However, these approaches require patience. A product that promises to erase decades-old spots in a matter of days is making a claim that science does not support. Real improvement usually happens slowly over several weeks or months progressing. Vital Aging believes the goal should not be chasing